patient having more or less metabolism, we order thyroid profile test. Thyroid profile has three main tests, that is total T3 level, total T4 level and thyroid stimulating hormone level. Total T3 contains both forms of T3, that is bounded form of T3 and unbounded T3. Bounded T3, that means it is attached with the serum proteins, and unbounded T3 is free T3, that is not attached to any proteins. We know unbounded form is very less when compared to the bounded one, and also thyroid gland releases more T4 as compared to the T3. The reason being T3 has short life as compared to T4, but T3 is more potent, means more active than T4. So coming on to the thyroid profile, first we need to know and learn the normal values of these hormones in our blood. The normal total T3 level is 0.8 to 2.0 nanograms per ml, whereas the normal T4 level is 5.1 to 14.1 micrograms per dl. The normal value for TSH is 0.270 to 4.20 micro international units per ml. One thing to notice here is that normal values of these hormones can vary according to the instrument and reagent we are using. I am telling you about the Cobas E411 instrument. So we know thyroid has two types of disorders, that is hypothyroidism or hyperthyroidism. In hypothyroidism, we will be having low amount of T3, T4, whereas in hyperthyroidism, the level of T4 and T3 hormone will be more than normal. Let's discuss first about the hyperthyroidism. We know hyperthyroidism is of two types based on the causing hyperthyroidism. It can be primary hyperthyroidism when the defect is in the thyroid gland itself, and it can be secondary hyperthyroidism when the problem is related to the pituitary gland. So in thyroid profile, we will see increased values of T3, T4 with decreased level of TSH in primary hyperthyroidism, whereas in secondary hyperthyroidism, more T3 and T4 will be accompanied by more or normal value of TSH. In hypothyroidism, we will see lower values of T3 and T4 hormones with increased level of TSH. Hypothyroidism is categorized as primary when there is problem with thyroid gland itself. It is called as secondary hypothyroidism when the defect is related to pituitary gland, and tertiary hyperthyroidism when hypothalamus is the reason. So in thyroid profile, we will see decreased level of T3 and T4 in primary hyperthyroidism along with increased level of TSH, because the defect is between the thyroid gland itself. In secondary hypothyroidism, we will see less amount of T3, T4 along with lower amount of TSH, because the pituitary is unable to release the TSH hormone, causing secondary hypothyroidism. In tertiary hypothyroidism, along with the lower amounts of T3, T4 and TSH, the level of thyroid releasing hormone from the hypothalamus will also be lower than the normal. And we will see lower amount of all the four hormones, that is T3, T4, TSH and TRH in tertiary hypothyroidism. In next part, I will be discussing about the thyroid profile and different thyroid disorders such as Graves' disease, goiter, Hashimoto's disease, etc. So stay tuned. Thank you.